we're back, as I stated. So we're gonna do another disorder today. Now, if you're hearing all that noise in the background, so you hear my refrigerator is old, and then you're hearing the garbage people come. So excuse the noise. So we're gonna do another video, and it's gonna be about schizophrenia. I don't know why it took me so long to do this video because I am so curious, and this is like another area of interest for me. So anyway, so let's jump right into the video. So if you're new, welcome, and then let's jump into our check-ins. So our check-ins here is basically describing your mood. So how are you feeling today? I usually do my dance move to show that. I don't even know if I have a dance move. Oh, I should have thought about that. Anyway, so you can use like your lyrics, you can use emojis, you can just type in how you feel as long as it's positive, as long as it is appropriate. So put that below, guys. So jumping right into it. So schizophrenia. I've seen it in my previous appointment. I also have had like secondhand story in my internship experience. So schizophrenia. So I wrote down that I'm looking at my notes, guys. You know, I got my handy dandy binder. So I wrote down, and it's noted that usually treatment begins in the late teens to 30s. So the early 20s in males, and then late 20s in females. So let's get to the criteria. So it's 2 or more of the following present of time during 1 month. So you have, it can be delusion, it can be hallucinations, it can be disorganized speech, it can be grossly disorganized or catatonic behavior, it could be negative symptoms. Okay, what it boils down is, so when they're asking you these things, like on assessments and things, you're at the doctor and they're asking you, do you hear things that other people don't hear? Do you see things that other people don't see? Tell me about it, things of that nature. This is what it's going towards, right? Going on, some of my other notes is substantially lower level of functioning as far as like hygiene and grooming. So maybe some people exhibit appearance being unkept, you know, hygiene issues, things of that nature. Going on, signs of disturbance is persistent for 6 months. You're ruling out schizoaffective disorder and depressive or bipolar disorder with psychotic features. So we talked about this different specifiers. And then things can also be unspecified according to the DSM-5. So you have to rule that out. So this schizophrenia cannot be caused by physiological effects of substance or medical condition. So I actually wrote down some associations. So some things that associate with the disorder, it can be like inappropriate affect. So you let's say you might have like a, you know how people usually react to certain situations and it's seen as appropriate or norm, and those words I always use loosely, guys. I always do this to show, you know, the definitions can be you know, there's really no real definition of normal or appropriate, but we all kind of get that understanding based on norms. So anyway, so association. So that was the first one. The second one is dysphoric mood, so depression and sad, anxiety, anger. Number 3 is phobia. We got a phobia video, or do we? Oh gosh. Social cognition deficient. We got a social anxiety disorder video. Number 5, lack of insight of the disorder, so not aware that they have this disorder. Number 5, lack of, oh, that's it, that was. Number 6, hostility or aggression, occasionally. And then there's also, so we have, so I mentioned in my binder in the other video that I have like assessments. So the assessments is used to kind of make a diagnosis. So you're asking the client to fill out this assessment, or you're asking these questions, and then you're based on what they share, that's you know, their symptoms, and you match them to the DSM-5. So anyway, so there's no test for this disorder. No test, surprisingly, right? Um, and as far as prognosis and recovery, it requires a daily living support for most individuals. So that means that the impairment from the disorder requires daily living supports. We're going to get into that, into treatment. So some of the treatments that is used is antipsychotic or anti-tremor medications, and that's the first line of treatment. And then a support group. We talked about the support group on postpartum depression. So with support groups, you can learn from each other. You can learn from the counselor or counselor in training. And then also feel that, you know, you're not alone. There's other people that's battling these same issues or situations. Rehabilitation. So that's going back to the impairment that may appear and require daily living supports. So it's so we mentioned like above about the uncapped appearance and maybe hygiene problems and things of that nature. So that's examples of what we mean here by rehabilitation and like daily living support. And then there's just some of the examples, right? Some. So CBT comes up as well, cognitive behavior therapy, looking at your behaviors and your thoughts, and disputing the irrational ones and coming up with healthier ones. Yeah, talk about that every video pretty much. You have psychoeducation. So one of the associations was the lack of insight to the disorder. So if you're educating the client on the disorder, maybe they can kind of match up the symptoms they're experiencing and kind of understand what's going on, because that is an association, right? So psychoeducation is important as well. Um, and it's also important to stress medical compliance. So if you taking medication for it, you making sure that your client is taking the medication, or you make sure you're taking your medication as it is prescribed. And then family therapy, like I said, it's good for your family to also know, you know, some tips and interventions and psychoeducation and this type of thing, like I mentioned in the movie review for, oh, I'm not even gonna try to butcher it, but you know, helps your family understand what you're going through, get tips and interventions. Okay, and then we have behavior therapy, which we just talked about, and generalized anxiety disorder video. So that's also another intervention. Um, and then you just, if you may not be familiar with like behavior therapy, um, it's pretty much like therapies used that gets clients involved. So you're giving directives as counselors, and then it also puts you in mind like ABA, behavior modification types of techniques and exercises and things like that. Just in case, guys, you haven't seen previous videos. And then group psychotherapy. So psychotherapy is talk therapy, and then group, you know what I'm saying, is doing, you know, going to group and you're practicing this talk therapy. And then you, of course, you have the person running the group. So yeah. that's the treatment for schizophrenia, guys. That's the DSM criteria. We did some associations. We did like the range for diagnosis as far as age, and then even how it broke it down as far as men and women. Um, we talked about you have to rule out these other disorders, and that's also important in any other disorder, guys. That's not just for schizophrenia. And then we also took note that there's no assessment for this. So I'll just take a little bit longer. We're at 10 minutes already, but I want to say that my experience. So I worked in a psych ward and at a hospital, and this was something that I did see. And then I actually had a client who confided in me and let me know that, they had a family member who was diagnosed with this disorder, and they live with this individual. And basically, some of the things they shared was their family member had a belief that their higher power was speaking to them. Okay, depending on your culture, that's not really considered like taboo or anything. Like I said, it depends on your culture, but it was something that was not normal for his situation. He had a job. He had not been going to work anymore. He would just leave work and and be doing these things that his higher power was calling him to do. So that became an impairment as far as financially. And then it was also stated that he would believe the television was reaching out to him, speaking to him, things of that nature. It had, she also shared with me he had bouts of like aggression and not really knowing what he would do, but she felt, safe with him because that was her family member, right? So yeah, just a little example of what it could look like, not really giving too much, but giving you these just enough to kind of see where some common, I wouldn't even say common, because that's not the correct wording, but just giving you some type of idea of how it may look every day, like an everyday life. And it's different for everyone, guys. So I'm not saying this is experienced by everyone. Anyway, let's wrap this up. See you next time. Put your check-ins below. Put your feedback below. Like, share, and subscribe. Hit the subscribe button. Hit the like button. And follow me on Instagram, Twitter, and Facebook, guys. Counseling minus the bull. See you next time.